Fentanyl and oxycodone are both opioids used for pain management, but they have some big differences in terms of how strong they are, how long they last, and what they're used for medically. Fentanyl is an extremely potent opioid, and it's much stronger than oxycodone. It's estimated to be about 50 to 100 times more potent than morphine, which is the benchmark for measuring opioid potency. Oxycodone, on the other hand, is around 1.5 to 2 times more potent than morphine. So if you do the math, that means fentanyl is about 25 to 67 times stronger than oxycodone. Due to its potency, fentanyl is reserved for managing severe pain, especially in cases like major surgery, cancer-related pain, or situations where other opioids just don't cut it. It's often administered in hospital settings under close supervision. Oxycodone, with its moderate potency, is more commonly prescribed for moderate to severe pain, and it's available as a drug prescribed by a healthcare provider. Fentanyl acts quickly, producing rapid pain relief. When administered through the vein, IV, or with patches, the effects can be felt within minutes. But its duration of action is relatively short, usually lasting only a couple hours. On the other hand, oxycodone takes a bit longer to start working, usually within 30 to 60 minutes, and its effects generally last for 4 to 6 hours. Both fentanyl and oxycodone are used recreationally, though it is illegal, and they can be misused and it can lead to opioid addiction. However, the potency of fentanyl makes it really dangerous. The fentanyl used in hospitals and prescribed as patches are dosed in micrograms. Illicitly manufactured street fentanyl starts with doses of like straight grams. For example, a patient with chronic pain might be prescribed a fentanyl patch that's dosed at 12 micrograms per hour. But I have Suboxone patients who used to smoke 1 gram of fentanyl every day. That's 10,000 times as much fentanyl. It's no wonder why fentanyl is actually the number one driver of overdose deaths in the US. Don't get me wrong, oxycodone can also be misused, but the risk of overdose is lower than fentanyl because it's way less potent, though it's not zero risk, especially when it's combined with other downers. Overall, fentanyl and oxycodone are both potent opioids used for pain management, but fentanyl is much stronger. It's usually used in severe pain cases, while oxycodone is more commonly used for moderate pain. Both drugs carry risks, especially when not used as prescribed. So it's important for patients to follow their doctor's instructions closely to avoid complications.